Hello, everyone. We're going to be talking about Chapter 19. These are drug therapy for your high blood lipids. And this starts on page 311 in the book. All right, so let's just do a little basic about it. So we know anti-hyperlipidemic drugs are to help lower lipids in the blood. We also know that our LDL, that's the low density lipoproteins, those are the bad cholesterol we don't want. And we know that HDL is our high density lipoproteins, and that is the good cholesterol, and that is definitely the ones that we want. We know cholesterol is produced by the liver. We know it's ingested in foods that we eat. Of course, we need to produce hormones they're good for. We need cholesterol for vitamin D, and we need them for bile acids. And we know those are used, that bile acids used for digestion of fat. We only need a small amount of cholesterol in our bodies, and the rest of it that we don't need gets out through the bloodstream. And this can cause a lot of problems. It causes plaque to start building up in the vessels, and we know that will cause narrowing and can cause a lot of issues with the body. So on page 312 and 313 are some lab values that you need to look at. Of course, table 19.1 is the lipid profile normal values. So when anytime you hear someone say, what are they checking when they're checking the lipids or the, liver and all, they're checking these. So they're going to be checking lipids profile, and those are some things to look at as well on table 19.2, the lipid value and risk for coronary artery disease you can take a peek at. But those are the lab values that we check when we're checking for cholesterol. So those are some things to look at. Not something that you have to remember, but something to at least look and know what we're checking for. These drugs are used when lifestyle changes are not helping. So when you start to decrease fat in your diet, you're exercising, you stop smoking, and you start losing weight, if that's not helping, then they do have to put you on medication to help bring things down. High lipid levels or hyperlipidemia puts people at risk for heart disease because it starts building the plaque up and causing narrowing of the vessels, which can cause a lot of problems in the body. So that's what we have to watch for. Chronic hyperlipidemia can cause other health problems like arteriosclerosis, coronary artery disease, hypertension, pancreatitis, peripheral vascular disease, can cause strokes, and xanthomas, which is that fat deposits that people get on their skin. So those are some things that happens when our cholesterol levels are high. Before we give any anti-hyperlipidemic meds, we want to make sure we obtain a list of all their prescribed as well as over-the-counter drugs and herbals, as well as we get all their allergies to any medications. We want to make sure we check if they're having any liver problems or if they have any muscle problems in the past or present. We need to know about that before they start these meds. And they need to have liver function tests done. So they need to get their liver function test as well as a lipid panel done before starting these medications to make sure that we know what we're working with and check everything out, make sure their liver's okay. Afterwards, we're going to make sure we give, these anti-hyperlipidemic meds, we're going to make sure we recheck the labs and report any abnormal findings to the physician. We're going to ask the patient if they're having any muscle problems, soreness, pain, or weakness, and that's very important for this chapter. We need to know about that. We're going to make sure we assess for signs of liver damage. That would be the jaundice, the dark urine, like the coffee tea colored urine, or light colored stools, so sandy colored stools. We're going to be looking for signs of liver damage and the right upper quadrant pain. We're going to teach our patients, encourage them to do lifestyle changes. We're going to ask the doctor before they take any over-the-counter medications. They're going to talk with the physician. And never, ever, 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 ever eat or drink 8 hours before getting labs drawn. Those liver function or lipid profiles, you need to fast before you take them because a lot of foods and drinks can cause changes in the levels. And we want to make sure we repeat labs every 3 to 6 months to see if the meds are working. So every 3 to 6 months, they recommend coming in to have it checked. Tell prescriber if you're female and are planning to become pregnant because some of these medications can cause a lot of issues with the fetus in regards to brain development. We'll be talking about that. And we also have to remember that the meds do not cure but lower lipid levels. So you need to be on meds for long term unless you're able to change your lifestyle with the diet and exercise and things like that. Sometimes it doesn't work. And if you try to even do those lifestyle changes, sometimes you still have to be on the medications. And make sure we take the medication as ordered. Take it as prescribed and how many times that, they're telling you to take it. Report any liver or muscle problems and any change in the urine, because those could be some liver issues. So there's 5 types of lipid-lowering drugs that we're going to talk about. The first one we're going to talk about is our statins. Statins are big, big drugs. We give lots and lots and lots of statin drugs. The nice part is to know the endings in statin. So STATIN is the endings for our statin drugs. These medications will help decrease your total cholesterol, which is good. It will lower your triglycerides and also your LDLs. And that's what we want to lower those LDLs. So on page 314 in the book is your common statins. And atorvastatin is the big one. Lovastatin, Pravastatin, and rosuvastatin and simvastatin are probably the big ones that I've given out there. But they do come with side effects, and those side effects are going to be on page 315 in the little picture book thing there. But a lot of GI discomfort, a lot of GI problems. You can have abdominal pain, cramping, gas, constipation. So you're going to see a lot of GI discomfort. Also liver problems, and also musculoskeletal discomfort. That's why it was important to find out if they had any liver problems or if they had any muscle discomfort prior to giving these medications. Now, adverse effects. The biggest adverse effects for our statins is rhabdo, and we talked about rhabdo before, rhabdomyolysis. That's the muscle breakdown. That's the soreness in the muscles. People complain of, they're in pain, they're weak. A lot of them have vomiting, stomach pain, brown urine, because what happens, they get this small reddish brown pieces of muscle that got broken down, and what happens, it gets removed from the body by the kidneys. So a lot of times when you see people who have rhabdo, you'll look inside the bag of their, like if they have a Foley bag, you'll actually see particles, like these strands of stuff inside their urine. And that is actually muscle. So it's very important to make sure we watch their kidney function, because think about that, having the kidney having to pull all that muscle fiber out. So you can have a lot of kidney damage with this. So we have to monitor our kidneys with this. We see a lot of rhabdo. People complain of rhabdo for people who I've fallen and I can't get up because they've been on the floor a lot of times and muscle starts breaking down, or people that over exercise and their muscle starts breaking down, those intense exercise programs. So those are some things we have to watch for. Statin drugs, rhabdo can happen. So we have to be very, very cautious with it, and it does occur. And we have to make sure if they do have rhabdo, we watch those kidney functions. So they also can have decreased liver function. So it's important. That's another side effect. So it's important to make sure we check those labs every 3 to 6 months. I'm going to say it again. And liver disease. And we're checking for the jaundice, the pain over the right side, below the rib cage, dark urine, that light colored stool that we've been talking about. So those are some things that we need to monitor for this. So afterwards, we're going to make sure before we're going to check the kidney functions. We already talked about that, the BUN and creatinine, but it's also very important to check our liver functions before. And if anyone drinks more than 2 alcohol drinks in a day, they need to notify the doctor of that finding, because this drug may not be the choice, because we know alcohol and anything with the liver is a no-no. Also, another thing we know, Tylenol or acetaminophen, it's also a no-no when it comes to the liver. So we have to be very cautious with that. Afterwards, we're going to make sure we look for signs and symptoms of our liver function, make sure we don't have any decreased function in it. We're also going to find about muscle breakdown, and if there is any issues that we're finding with the liver or the muscle, we're going to report that to the physician as soon as possible. We're going to monitor our urine output, because we know it can lead to renal failure, especially if we get that rhabdo and the muscle breakdown. It will block the urine flow and cause so many issues. So we want to make sure our kidney functions are good and we watch that urine output. And we're going to make sure we monitor labs. Liver, we're going to check the liver functions. We're going to check the BUN and creatinine. And so those are some things we have to check. We're going to make sure we teach our patients, instruct the patients when to take the med. Some meds are given in the morning. Some can be given at bedtime. Some have to be given with food, some with meals. So just depending on twice a day when you give them. Pregnant or breastfeeding population, never, ever, ever to be given to any female who wants to be pregnant or is breastfeeding. So they will definitely do a pregnancy test before they start this medication to make sure you're not pregnant. If you're planning to become pregnant, that is something to discuss with the doctor before you start these medications. Bad thing is that statin drugs remove the fat in the body, which is needed for brain development. Without that fat, you can have poor brain development and you can actually have children that are mental retarded, have low brain development. So those are some things that we have to be very cautious with statin drugs in the pregnant population. And also think about breastfeeding. You don't want to breastfeed because if it's the baby needs fat for brain development, you definitely do not want to be taking statins to take that away from the child. Now, our older population, it's okay to use unless they have muscle problems, if they have like myopathy or liver disease, because that's only going to make things worse for them. And report any new muscle problems because it could be rhabdo. And like I said, the muscle weakness, muscle aches, and joint aches are usually the first thing that you're going to hear them complain about. So anytime statins, think, oh, rhabdo. So that's statin drugs. Now, the next thing we're going to talk about is our bile acid sequestrants. These ones start on page 316 in the book. So these ones will work on your dietary fats in the intestine. These are the ones that bind to the cholesterol and remove it through the stool. So that's a lot of times you'll see people who are on these medications, they'll have stools that float because they're full of fat, because it works with the food and the digestion. So on page 316 are some of our common bile acid sequestrants. And cholestyramine, that is probably the biggest one that I've ever given. I've given the other two, but I see more of that first one than anything else. So that is probably the biggest one. Now, when it comes to side effects, GI discomfort big time. It can cause constipation, and constipation is probably the bad thing about that, the bloating, nausea, vomiting, and gas. These medications you got to be very careful with constipation. You've got to drink lots and lots of water with. Now, adverse effects, decreased ability to absorb oral drugs. Okay, so think about it. A lot of these you're going to be taking when you eat. It works on your food through the intestine, so it's going to pull out a lot of that dietary fat through the intestine. So if you're taking vitamins, it's going to pull out stuff. So think it's going to prevent your fat-soluble vitamins getting in. And what are our fat-soluble vitamins? A, D, E, and K. Those are the 4 ones that it's going to definitely pull them right out because they're fat soluble. So it's pulling out the fat out of the system. So a lot of times you do need to take a vitamin supplement daily when you're on these bile acid sequestrants. The big thing that's bad is if these meds can affect the actions of warfarin or Coumadin in few ways. It will decrease the absorption of vitamin K. So if we decrease the absorption of vitamin K, what happens is it will increase the effectiveness of warfarin. So it puts the patient at risk for bleeding because warfarin and vitamin K is the antidote for warfarin. So when our warfarin levels are very high, we give vitamin K to bring it down. So they work opposite of each other. Okay, well, the vitamin K works opposite of the bleeding thing. So if you're pulling out that vitamin K, it's causing warfarin to be very strong, and that's why it's causing all this bleeding. So if that's going to occur, the people may need to get a vitamin K. They can get a sub-Q shot, they can get an IV dose, or they can even take a PO dose to help thicken up this thin blood. And, so we have to remember that with bile acid questions, that vitamin K is going to be pulled out of the system and make warfarin worse. So we'd have to monitor that lab value very closely. That's the first way that affects. The second way that these meds will bind with warfarin in the intestine tract and cause it to be eliminated quickly. So think about it. So if it's pulling out the drug quickly, the warfarin, what is that going to do to the patient? Well, it's going to make the blood thicker or not coagulating faster. So, it's not going to be thin as it is. It's going to be very thick. The blood's going to be thick, thick, thick. And what is that going to do to the patient? It's going to cause them to have clotting issues. So imagine if they're taking it to prevent clots, it's going to cause clots. So what is going to happen? Strokes, heart attacks. So those are some things that we have to monitor for. So that's how it's going to be working. So we have to very, very, very closely watch lab work when they're dealing with bile acid sequestrants and people on warfarin. They're going to have to check INRs. So anytime you see INR, you know that is for warfarin or Coumadin, and make sure that lab value is good. And they're going to be checking that pretty frequently. So those are some things we have to watch for. So those are some things for the adverse effects. Now, when we're dealing with what do we do before we give it, like I said, do not give these meds. We are not going to give these meds within 2 hours of taking any oral med because it will interfere with drug absorption. Okay, so within 2 hours of taking any, these meds should not be taken 2 hours before or 2 hours after any antacid because it will decrease the effectiveness. It's very important to make sure we ask the patients afterwards about their bowel movements if they're constipated. These drugs can make that very, very, very worse. The bad thing about it is that some of them you have to mix with juice or water, and if you don't mix them properly or that, you can actually cause a bowel obstruction. So that's why it's very important to mix the medication of how it is recommended on the package and have them drink lots of water, as well as drink lots of water when they take the pill. I think about 12 to 16 ounces of water they recommend taking with the pill because it can cause bowel obstruction. So it's very important to make sure we mix the powder form appropriately, and we also make them drink lots of water, and we'll be talking about that again here. So we're going to make sure if the patient's on warfarin, we're going to check that very closely. Afterwards, we're going to make sure we monitor for those GI side effects that can occur, especially that constipation we have to be very cautious with. If they're not going to the bathroom, having a lot of bowel issues, it could be obstruction, and we're concerned about that with this medication big time. If they're on warfarin, make sure we watch out for signs of bleeding. So we're going to be monitoring for that. We're going to also teach our patients about signs of bleeding if they're on warfarin or Coumadin. We're also going to make sure we monitor the INRs on them closely. We're going to make sure they get a vitamin. If the doctor wants to prescribe, they should be taking a multivitamin to help with that eliminating of the A, D, E, and K. We want to teach our patients about these drugs. We want to make sure that they take these drugs with meals because it will bind with the cholesterol in the intestine and pull it out. So a lot of times these meds are given with meals. And don't take any other meds for 2 hours before, and they say 4 to 6 hours after taking bile acid sequestrants. The powder form of this drug is to be mixed with 4 to 6 ounces of fruit juice or water. And you have to drink about 12 to 16 ounces of water when you take the tablet to prevent stomach problems like bowel obstruction, like the abdominal pain, bloating, nausea, the vomiting, diarrhea, or constipation. So those are some things we have to work. Sometimes bile acid sequestrants are prescribed with statin drugs. The pregnant and breastfeeding population, again, issues of taking this in regards to the development of the brain of the fetus because you need that cholesterol for brain development. So it's still up in the air, and that's something to talk with your OBGYN. So that is bile acid sequestrants. So some things that you have to make sure, but remember, have like the drinking lots of water. They can't be 2 hours before, 4 to 6 hours after, 2 hours before, 2 hours after. We're keeping with the antacids, and to mix it appropriately and make sure we get our liver checked and all that stuff done. So those are some things with that. Now the third one, because we have 5, the third one is our cholesterol absorption inhibitors, and that's on page 317. And you can see these ones are used when our low-fat cholesterol diet isn't working, or to help lower the levels. Excuse me. Alternative med for patients who can't take statin drugs due to the side effects that occur with it, especially remember statins, the rhabdo. Also, drugs, sometimes they are prescribed with statins. So sometimes they'll give these if they don't want the statin ones. Sometimes they will prescribe them actually with statin drugs to help decrease cholesterol if statins aren't doing it by themselves. But of course, the goal is to decrease cholesterol absorption by the body. So that is the goal of it. On page 319, the common drug for it is ezetimibe, and we do use that. Zetia, we use that, and usually it's given once a day. The side effects, and that's going to be on the next page. On page 318, Side effects for these, they do have GI problems, abdominal pain and diarrhea. They can have some joint pain, fatigue, as well as a rash. So those are some things that we have to watch for. Um, adverse effects, angioedema. And we've talked about angioedema and how important it is to make sure that they go to the emergency room ASAP. It's rare, but it can happen, so we have to watch for that. So before we take these meds, ask if there's any liver disease or muscle disorders. We're going to obtain a liver function labs. We're going to make sure we do that. If they have liver issues, it can become worse if they're taking with statin drugs. We have to really, really monitor the liver then and watch for the signs and symptoms of liver issues. Afterwards, we're going to watch for any signs of liver issues, muscle problems, or that angioedema. It's rare, but it can happen. We're going to teach our patients about these meds, report muscle pain, tenderness, or weakness. We're going to take the pill daily, same time, every day. And we're going to make sure we give these meds, if they're with a statin drug at the same time, we know to give Bilat, or, we can give that med, we can give these ones with statins at the same time. But remember, with bile acid questions, 2 hours before, 4 to 6 hours after. And of course, we have to teach about signs and symptoms of angioedema. So that was number 3. Now, number 4 is our fibrates, and that starts on page 318. Our fibrates, these ones will decrease triglycerides and slightly increase your HDL levels. These meds are what you want to prescribe if your triglycerides are elevated. So these are more for your triglycerides than anything else. Also, they remove cholesterol in the bile. So, that's another issue that they're going to have. So on page 319, the common fibrates, and I always look in the middle, you can see it says FIB, F-I-B, well, FIB, but FIB, I think of the fibrates. So that's how I can remember. And we give both of those. We give the fenofibrate as well as the gemfibrozil. So both of those have been given pretty frequently for cholesterol. Side effects, again, if you notice, we're having a theme of GI discomfort. And again, GI discomfort. But in this case, this one's going to cause diarrhea. We know bile acid sequestrations, they were causing constipation. This one's causing diarrhea. So upset stomach, diarrhea, pain, nausea, and heartburn can occur with these medications. Muscle pain, weakness, headache, and rash can occur. So those are our common side effects, and those are on page 319. Now, adverse effects. Kidney disease. The meds will increase your creatinine level, so it's going to be very important to make sure we check the lab work before we start this medication. So we're going to make sure we get that creatinine level. You will lose a lot of cholesterol in the bowel, which can lead to development of gallstones. So if you're losing a lot of cholesterol, gallstones. So we have to monitor for that. So if someone who has a history of gallbladder disease, this is probably not the drug of choice for them because it's going to make things worse. Bleeding can occur on these meds if you're on warfarin. Fibrates will increase their effectiveness, so you're at risk for bleeding. So if they're on warfarin and they're taking these meds, then we definitely want to make sure that we check their INR levels because that's going to be very important. So what do we do before we give these meds? Of course, we're going to make sure we know if there's any kidney, liver, gallbladder disease. Afterwards, we want to make sure we keep monitoring the kidney, liver, and gallbladder. So we're going to be checking the urine output. Poor appetite, fatigue, weakness, nausea and vomiting, abdominal pain. We're going to be watching for signs of bleeding, especially if they're on warfarin. We're going to make sure we check the INR level frequently. We're going to check other lab work. We're going to check the kidney functions because it will increase the creatinine level. And we're also checking the liver functions and make sure that a lot of our liver things are good. So we're going to be checking for that. We're going to teach our patients, take these meds 30 minutes before a meal. Okay, so fibrates, 30 minutes before a meal. Avoid alcohol. If they do drink, no more than 2 drinks per day, because we know alcohol affects the liver, so that's a no good. And then no grapefruit juice. Okay, it shouldn't be taken with these meds because it will interfere with the metabolism. So no grapefruit juice. So remember, if you're making a list, put that on the list. And we want to make sure we teach our patients signs and symptoms of bleeding. Very important because especially if they're on warfarin, it can interfere and cause the effectiveness of warfarin to increase, so they can have some bleeding issues. So we have to watch for that. And our older population, surprise, surprise, those are the ones mostly on warfarin. So those are the ones we're going to be teaching signs and symptoms of bleeding and making sure that they get their INR checked more frequently. And then, of course, they do recommend, if they do get their INR checked, that they have it checked weekly, just to make sure everything's okay with when they're on the fibrates. So that's number 4, the fibrates. Now, the last one we're going to talk about is our nicotinic acid. And this is it starts on page, give me a second, 320. And we know that, and you've noticed that there's only 2 meds on there, and guess, surprise, surprise, it's niacin. We have an intermediate release one, and we have an extended release one. Very important with these is these 2 medications cannot be interchanged. They have to be given. They're also ones that we cannot crush because of the intermediate and extended release ones. We can never crush those. But these are very important. They cannot be interchanged. Whatever the doctor orders, that is what they need to be prescribed. They can't take any of the different ones because they're different how they release through the body. All right, so we know niacin, that is vitamin B3, that works to decrease triglycerides. It's good to decrease your cholesterol, decrease your LDL, and increase that HDL, and that's what we want, that increase of that HDL. It's given in higher doses than normal daily requirements, so what you get over the counter is going to be totally different than what you're going to be prescribed. They're not quite sure how it works, but they know that it gets the job done, so they prescribe it. So that is one thing good about it. The side effects for it, you can see that on page 320. The itching, they have nasal inflammation. Again, GI problems. In this case, nausea, vomiting, diarrhea, indigestion, and gas pain. So that's going to be. These meds will cause blood vessels to dilate. And this is probably one of the biggest things patients complain about. They complain about they get a flushing, like a redness, and hot flashes. They complain about it all the time, like flushing, hot flashes. They can complain of chills, dizziness, fainting, headache, tachycardia, shortness of breath, sweating, swelling caused by fluid retention. But the big one is the flushing, getting like a redness over them, and hot flashes. That is probably the biggest complaints that I've heard about these medications. So we'll be talking about how to help that when we go through this. Now, adverse effects, liver issues, and remember, these ones will affect gout so if you have a history of gout, it can make gout worse. So gout is also when you get that swelling and painfulness in the joints of your toes, the knuckles, your feet, ankles, elbows, anywhere there's joint, they get these swelling, painful inflammation area, and that's just due to a buildup of uric acid or sometimes calcium buildup, depending on which one it is. Also, another adverse effect is hyperglycemia, and that is we better watch our diabetics. They need to monitor their blood sugars more frequently because it will increase their levels. Stomach ulcer flare-ups, so if they have a history of stomach ulcers, it can cause them to flare up. And we would never, ever want to give these to people diagnosed with hypertension, peptic ulcer disease, and active bleeding, because it's going to make things worse. So those are some things we would not want to do with this medication. So before we give this med, vital signs, blood pressure and a heart rate, we better check them. If you're a diabetic, we're going to be checking your blood sugars more frequently. And if we notice that the blood sugar is elevated, we're going to adjust your diabetes medication. We want to make sure we check the liver function test before we do anything. And to prevent the nasty flushing, the redness, and hot flashes, they recommend giving an aspirin, a 325 aspirin if it's not contraindicated, 15 to 60 minutes before taking the niacin to help with that side effect. So besides the aspirin, any type of NSAID, non-steroidal anti-inflammatory drug, that is something that they can take. And you can see that on page 321 in the administration alert. Now remember, go through those because those are very important to look at. So they do recommend the aspirin, but NSAIDs, and aspirin is an NSAID, so you can take an NSAID before 15 to 60 minutes before taking. After we give these meds, report changes in liver function test. If you have gastro problems, take the meds with food. Monitor the glucose level because they can be higher than they can be higher when they're on these meds. So we have to check the glucose levels for our diabetics. And we want to teach their patients to start low on the dose and gradually increase it. If you take with a statin drug, you can have the muscle pain. Remember the rhabdo, tenderness or weakness. So you have to remember you're going to be teaching them about two different things. And if they're on bile acids questions, we're going to make sure we take it 2 hours before, 4 to 6 hours after apart, because it will decrease the effectiveness of the drug. And aspirin or NSAID if they're having flushing and hot flashes. Don't interchange these medications. We already talked about that. Do not crush these drugs or mix with water because it can cause an overdose. And diabetics, check your blood sugar more frequently. Report if you're on these meds and you're having any surgery or dental work, because it can slow clotting process and cause more bleeding. So that's something we have to worry about. And our pregnant breastfeeding population, they do not recommend breastfeeding. So that is basically chapter 19 of the book when we're talking about lipids. If you have any questions, make sure you can email me. But like I said, always message me on my cell phone. That's the easiest way to get a hold of me, because sometimes my email doesn't work. So any questions, go through that chapter, look at those side panels, and if I expressed anything very important, make sure you monitor that. All right, I'll be back with another lecture, guys. Once I can stop this recording thing.